Hello, my name is Tyler Martin. I'm an RN and also I am a psychiatric mental health nurse practitioner student. Today I'm going to give a presentation on healthy body, happy mind, the diet-exercise connection. So why is caring about diet and exercise important? So poor diet and exercise, they're both modifiable risk factors, which means that these are two things that we can change, we can modify. Unlike our genes, our genetic composition, those are things that we cannot change, but diet and exercise, those are things that we can change. Diet and exercise is very important for all of us, very important in thinking about mental illness. So patients that have a history of mental illness, they have higher rates of death than those that do not have mental illness. So their rates are up to 2.2 times the rate of death versus someone without any mental illness. So on average, according to the research studies, if you've been diagnosed with depression, anxiety, schizophrenia, bipolar disease, you can take up to 10 years off of your life just with that diagnosis. So it's very important that we make sure that we're eating a proper diet and exercising to try to offset those time frames. It's been shown that up to 14% of deaths worldwide have been attributed to actually a mental illness also too. So those things such as major depressive disorder, generalized anxiety disorder, schizophrenia, bipolar. So it's very important for us to get treatment for those things and also to take care of our physical and mental health. So it has been shown that what we ingest, what we eat is linked to our mental capacity, our mental disorders. There has been a positive correlation between ultra-processed foods consumption and adverse mental health symptoms. So that means that the more that we consume those ultra-processed foods, the higher rates of anxiety, depression, also worsening ADHD that is seen in the studies with patients. They have done studies with schizophrenic patients, bipolar patients that were admitted in a psychiatric unit and looked at those patients. They fed them a diet that was without ultra-processed foods. It was actually a ketogenic diet that was high fat and moderate protein. And they showed that those patients during their hospital stay, that they had better psychotic scores. So that means they had less psychosis, hearing voices less, seeing things that weren't there, and they had better sleep and also less anxiety, less depression with that change in diet. It's also very important for us to think about our macronutrients, such as protein, carbohydrates, fats, and also our water consumption. So there has been studies that have shown that there is less depression when you actually eat a higher protein diet, especially those diets that are higher in protein that include dairy products. Diets higher in isoleucine and tryptophan, which are essential amino acids, had an inverse relationship with depression. So that means the higher that you consume those essential amino acids, the lower rates of depression that was seen in those studies. It's also very important to drink water. Drinking less than 2 cups a day of water was associated with a 73% increase in risk of depression in men and about 54% increase in women. So it's very important for us to make sure that we're drinking adequate fluids, especially if we're at a higher heat climate like in Imperial County. Vitamin deficiencies are very important also. Whenever we see patients for any type of mental illness, we all, such as depression, anxiety, we always want to be looking at, their vitamin deficiencies. So things such as low vitamin B6, B12, those things can cause worsening mental health symptoms or also be the true cause of those mental health symptoms. So it's very, very important for us to screen for those. Also, things such as omega-3, which is very important to be consumed. Patients that consume more of these have been seen to having less rates of mental illness, less depressive symptoms. There's also a correlation between magnesium intake. So the more magnesium that we eat, the less rates of depression, anxiety, also the better sleep that we get with more magnesium intake. With low magnesium intake, those patients will have higher rates of headaches, higher rates of insomnia, higher rates of other types of medical illnesses. So it's very important for us to make sure that we're getting adequate amounts of those things in our diets. And it's been shown that about 2 to 15% of Americans have a low magnesium level. So it's very prominent in our society. Increased zinc intake is also very important because a higher zinc intake is related to lower mood disorders. So like lower depression, lower anxiety, and better sleep with higher zinc intake. Also selenium, so it's another mineral. Higher rates of selenium intake was associated with lower depressive symptoms. So it's very important for us to get these things in that we're going to get from whole foods. So vegetables, fruits, also nuts, beans, different types of proteins. So these are very important. Dairy also for our calcium, also different B vitamins. Very important for us to get those in. Like I talked about earlier, B6, B9, B12 are also very important for mental health. Lower rates of those in our diet will actually lead to higher irritability, actually higher aggressive symptoms, metabolic dysfunction. That was seen in children with autistic spectrum disorder. So those things are very important for us to get in our diets. And probably one of the things that we hear about the most is vitamin D, which is a very important vitamin. It's also actually a hormone. It's needed for many things in our bodies, such as bone health, immune function, and our well-being. Deficiency of vitamin D has been shown to have increased anxiety, increased depression, increased stress. And we saw during COVID that those patients with the lower vitamin D levels had a worsening outcomes with regards to that illness. Vitamin D influences our mood by affecting neurotransmitters such as serotonin and dopamine. It also has a neuroprotective behavior or function, which will help to aid in our learning, our memory, and also our overall brain function. It also aids in calcium absorption, and it actually needs magnesium to help activate and regulate vitamin D. So vitamin D is a very important substance for us to be taking on a daily basis.